My name is Kenneth Edwards. I'm Executive Director for the California Association for Licensed Professional Clinical Counselors. And you get 3 points if you can say it 3 times fast. I'm based in San Francisco, and this is the cultural and mental health considerations of having a fat disorder. I also work in private practice, so I get to see patients every day, but I also get to use the other part of my brain to advocate for mental health across the state of California. And I'm really excited to be here, so I get a chance to talk about mental health. It's one of my favorite things to talk about. But like all therapists, I'm going to ask you the question, how do you feel? Yes, how do you feel about that around every turn? I think that what it does is it establishes the way that we sort of walk into the space. So if you think about it right now, take a quick second. How do you feel today? I like that feeling. That's a good feeling. Anybody else want to yell out, how are you feeling today? Overwhelmed. Tired. Beth, good to see you. What's that? Inspired. Great, great. So what are we going to talk about today? Oh, I have nothing to disclose, by the way. I hear there's a disclosure slide. We talked about how we're feeling. What are we going to talk about? First, some stats around lipedema and mental health. I think that it's important to ground ourselves in the data. It's important to ground ourselves in what the numbers are, and we're going to take a look at a few stats. My favorite section is the next one that I hope you all will enjoy too, the effed up stuff that people say. Okay? All right? We're going to go into a really, really fun activity on how to identify some of those things. We'll talk about the combination of mental health issues and physical health. And then what about your feelings? We're going to come back around to this subject around feelings. We're going to look at what it's like to be hit from all angles, from your doctor, from your family, from your friends, just from society as a whole. And then we'll talk about getting help and support. How does that sound? Yes. Okay, all right. Thank you. I appreciate it. But the biggest thing that I want you to walk away with are some tools for how to get to the next day. Many times we hear the science, we've heard from some really smart people the last couple of days, and I hope I'm just as smart too. But you've heard from some smart people around what to do from a medical perspective. I'm here to help you with what to do from a mental health perspective. All right, so here are some statistics from the standard of care of lipedema in the United States. You've probably seen some of these stats already, so I don't want to go too much into them, but it helps to ground what we're going to talk about. 85%, and this is taken directly from the article, 85% of women state that lipedema affects their mental health, coping abilities, and self-esteem. Makes sense, right? Depression has been observed in 18 to 35% of people experiencing lipedema, and that's exceeding the average in the population. And on standardized measures of healthcare-related quality of life, anxiety and or depression was found in 42% of people. And then self-reported anxiety affected up to about 30% of people with lipedema specifically. Those are some pretty harrowing stats, right? Psychological pain scores were higher. Early diagnosis and treatment may mitigate the impact. But if we look here, we see, even in a study of 100 people, we look at the periodic binge eating attacks, bulimia, anorexia nervosa, and other issues. And then improved mental health care increases self-care with women with lipedema. Interesting, right, to know some of the stats. So you've probably seen these before, but we wanted to repeat this. Now, this is my favorite part, okay? So as we think about those stats, there's a friend of mine who wrote a book, Say the Quiet Part Out Loud. I don't want to get in trouble, so I am not going to say the first part of this sentence here. But this context, this label for this is all of the persistent, systemic, intersection and evolving ways that status and superiority play out. Race, gender, ways of thinking and moving, ableism, fat phobia, class, religion, and sexual identity. It disconnects us from ourselves and each other and lies to us about what the future can be. I thought that this was such a beautiful statement, and this is the chapter in the book. That's what it's called, that first word, so I won't say that. And please don't tell my grandmother if I do. So I want you to take a second here. Take out your paper or your notepads. What have people said to you? List 2 things that you've heard from well-meaning people, okay, that are downright appropriate, offensive, rude, well-meaning but still not good, caring but still not good, and the off-putting things that people say. And in just a second, I'm going to take some brave volunteers to just yell out and tell me what those are. I'm going to repeat them in case everybody didn't hear it, and then we're going to say one of 2 things in response back as a group. Got that? What are those one of 2 things? All right, who wants to go first? Yes.
You would be so pretty if you lost 50 to 100 pounds.
Ooh, ready? Dang, that's messed up. Thank you. What's next?
No offense, but where on earth did you find boots that fit over your calves?
Oh, that's fucked up.
Oh, well, there you go. All right. There we go. I love it. Go ahead.
They said, you do take up a lot of space, and they met my personality, but my body is attached to my personality.
Oh. Right. One more. We got time for one more. Yes. Right here. Yep.
I had a doctor ask me if lymphedema meant my lip was swollen.
All right. So I cannot imagine. I absolutely cannot imagine that someone would say these things. But you know what? Those are people who are charged with being our friends, who care for us, who are supposed to care for us, and they think that these comments are not harmful. Well, they're harmful. The purpose of that activity was for a couple of reasons rather. One is to just sort of put it out into the room so that we could all validate what a tough experience that was and what that meant. The next part that was important when we talk about hearing those types of statements is, wait a minute, I'm not crazy. I heard what I heard, and that's what it meant. So we're able to validate ourselves, but also we're able to hear the validation from other people that, wow, that was really messed up what that person said, and they shouldn't say things like that. Hold on to that activity, take it back to your spaces and groups, and be able to bring that. Did you like that? Did you like that activity? Okay. All right, so how about my feelings? How does all of this affect me? Now, I don't know if you've ever seen this illustration. Go ahead and write this down. It's called feelingswheel.com. Feelingswheel.com. This is probably my favorite tool to use in a clinical setting with my patients. So the way that I describe this is that, there's this kind of floating orb of feelings whenever we've gone through anything. And it could be anger, it could be frustration, it could be sadness, it could be feeling offended, it could be feeling lonely, all of those things. But when we mash them all together, it becomes this thing that becomes really difficult to break apart. And understanding the individual words that are attached to feelings actually helps us to tease it in a way so it makes sense. So take about 30 seconds or so, and we won't call this one out, but take a few seconds to write down how you're feeling today, right now. And you know that thing when we meet somebody and we're like, oh, how are you doing? They're like, fine. Well, people try that with me in therapy, and then I just hand them this piece of paper. And I'm like, no, there's more than fine. There's more that exists out there than fine. Did you learn some new words by seeing this? All right. So dealing with a long-term physical health issue and combining that with a mental health issue, that's a lot to contend with. So let me see here. So how do we deal with the things that the doctor might say? The swollen lip. I mean, seriously? It must be Canada. It's the maple syrup. That's what it is. The things that the doctor is saying, looking at new treatments and what can I afford to do? What are my friends saying, the people who are supposed to love me, my family, what are they saying? What are the things that I have to contend with every day, and how does that combine with what I'm actually feeling physically and what I'm having to experience? So there are many factors that could influence that combination of what you're going through. Now, before we start here, there are mental health issues that we all experience just from our childhood experiences, trauma, growing up in poverty or marginalized populations, dealing with misogyny, racism, sexism, all of the isms, right? But when we start to think about those issues, that we come in on a base layer, and then we have to pile on top of that a medical issue, oh my gosh, there's so much. There is so much there, and I see the head nods in the audience because it's like, wow, now that we're actually able to label these things for ourselves, now I can breathe a little bit. And it's kind of what I get to see in therapy with people when they're on my couch. It's like, wow, thank you for actually validating what that thing was that I was going through. Now, I had a chance to review the lipedema research roadmap that the foundation put out. And I'll be honest with you, this was one of my first times getting a chance to read some of the scholarly research along with the roadmap from the stats that I mentioned earlier. And what really broke my heart, and I think I knew this already, but what broke my heart was seeing how early on, even from the point of getting a diagnosis from a doctor and them invalidating the experience of people, I just shuddered. And I could only imagine what many people in this room have gone through when even your trusted doctor says, that's not a thing. And how, if we had caught this early on, and even being able to diagnose and label in a way that made sense for people, that people from a mental health perspective would be feeling better today. Ooh, it makes me sort of shudder when I think about it. So some people experience from those early years any number of issues related to disordered eating, suicidality, self-harming behaviors, anxiety, depression, name the list, right? There's so many things. Some people experience, if we talk a little bit more about anxiety and depression, we look at symptoms related to depression. So that might be sadness, tears that seem to come out of nowhere. Eating too much or too little, sleeping too much or too little, emotional outbursts, whatever they may be. When we look at anxiety, those same emotional outbursts exist. There are a lot of symptoms that just come up because of what we're feeling. Now, Kenneth, if you would ask me the question, what are the triggers for these symptoms? I'm so glad you asked. I'm very glad you asked. So some of the symptoms that come up for people, or the triggers, are just those little reminders throughout the day that remind you that you have something that you have to live with. Those are triggers. That doctor's appointment where the doctor says something crazy. Those things that out in society that we talked about earlier, those effed up things that people say and do that really make us feel a certain way. Leaving, what's that? Putting compression on. It's a reminder, right? Constant reminder. Thank you for that. So what do we do once we recognize these things? Oh, I was supposed to have that slide up there while I was talking about it, so you can take a look at it. But these are all of the symptoms that we look at for depression. This is what we look at for symptoms related to anxiety. And also, those are some of the triggers that we just talked about. And I would say even as I'm thinking about it out loud now, having people not understand is probably one of the worst. Wow, say that again?
It's the worst.
It's the worst. You feel like you're not trusted. You don't feel listened to. You don't feel heard. I would go so far as to say you don't feel loved when someone says, no, that's not it, it's that. I don't believe you. That's what it says. How are y'all feeling? Oh, still, good. How's everybody feeling? No, I'm a therapist. No more good. It's no more good. What else? Still overwhelmed. That's fair. Yeah. What's that? Validated. That's exactly the goal of this presentation. Is to, powerful, it's a great word. So what do we do with all of these feelings? What can I control? Okay, if you have a piece of paper, just make a little chart like this. It's the simplest tool that I use in the therapy setting. It seems kind of ridiculously simple, okay? We know that our mental health hinges on how we perceive the world around us and how we've been influenced or brought up by the world around us. Sometimes in therapy, what we have to understand is what we can control and what we can't. I can control how I respond. I can't control what people say. I can't control what people say or do. We just talked about that a few minutes ago. But I can control the way that I respond. That brings a lot of control. So, again, now that we've talked about some stats, we grounded ourselves in the stats, right? We took a look at what the prevalence rates were for anxiety, for depression, for any number of mental health disorders as they're co-occurring with a medical diagnosis. How do we get help and seek support? So the biggest thing is seek community. Everybody's done that here. That's what we're doing today. We're building community. Be surrounded with like-minded people so that you're able to do activities like the first one that we did to validate ourselves, number one, but number two, have other people validate the experience. That's important. Teach your family members how to validate you, okay? Many people, I find, don't know how to validate other people. They think that by saying, oh, it'll be okay, that doesn't mean anything. That doesn't do anything, right? Tell them, hey, you know what? When I tell you how I feel, just say, oh my gosh, that must be tough. That must be really hard. How are you getting through it? That's an actual validating statement. Find a therapist that specializes in those with long-term medical diagnoses. That's a specialized part of the field. There was a question online that came from someone who was, I think, watching through the streaming, is what type of therapy do I find? Is it CBT, which is cognitive behavioral therapy? Is it REBT, rational emotive behavioral therapy? Is it DBT, dialectical behavioral therapy? Is it psychoanalytic? I would tell you the best answer, and this is a very non-committal therapist answer, but find a therapist that listens to you and that validates your experience. That's what's the most important. When you get into your sort of advanced level therapy, then of course they will recommend interventions that are specific to any number of things. And you might go to therapy for something related to a fat disorder, but it might be completely unrelated. It might be work stress, it might be home stress, it might be money, or whatever it is. So it's important to find a therapist that you connect with. So the next thing here is to continue to engage in self-care. Like my friend said earlier up on stage, find the things that you like to do. Do them early, do them often, okay? If you don't feel like doing that anymore, do something else on the list of something that you like to do. Journaling and writing. I see a lot of people taking notes and writing. What I tell people in therapy sometimes is, you know how we get into these thought patterns where we get into like a tornado in our minds and we fall down a thought spiral? The number of head shaking. I'm like, yep, I know, that's the one. Is we get into these thought spirals. The best thing, and I'm not the best writer, I don't journal a lot, but sometimes taking a quick note that says, you know what, I'm feeling, pull out the wheel, I'm feeling this today and this is why. Check in with yourself, and that tends to help to get out of that thought spiral. So make a pattern of actually writing down what you're thinking and feeling. The next thing sounds very easy to do. It sounds incredibly easy to do, but it's not. Be nice to yourself. We already heard the effed up stuff that people say, right? It doesn't do us any good to repeat those same things to ourselves because we know it's not true. We know good and well it's not true. And then understanding that restarting the journey is just fine. And that might be with therapy, it might be with treatments, it might be with talking to like-minded people, it might be going to groups and any of those sorts of things. So we've talked about a lot today in a very short amount of time. I wish I could talk for the next hour on the subject, but then you'd be bored and I would just run out of words to say. But we had a chance to go over some stats, right? Ground ourselves in what we're talking about and understanding why it's important to talk about mental health. And, you know, I talked to my good friend who invited me here and Cheyenne. Everybody knows Cheyenne. And it's really disheartening how little the research has come around how people are experiencing their mental health alongside their medical diagnosis. So I hope to contribute to that body of knowledge. I hope to keep talking about it. Please have me back again. I had a really good time learning a lot, and I really appreciate you all for listening today. Thank you. Thank you. Thank you. Okay. Are you ready? Oh, I have one more thing. I guess I should have done that before. Does anybody I have about 1 minute. Do you have any questions? Anything you want to say, how you feel, what you're thinking? Yes.
Where do you find a therapist who specializes in long-term medical diagnosis?
The best place to start is
Can you repeat the
psychology.
question?
What's that?
Can you repeat the question?
Oh, sure. The question is, where do you find a therapist that can help, right? That focuses on long-term, it specializes. So I know that I was at the dinner with the Lipedema Foundation last night. There's a therapist referral network that's being put together. But the resource that I would give to anybody is Psychology Today. Psychologytoday.com. You can type in your zip code, and it's got probably, 30, 40 little check boxes of different conditions and things that you can check to find a therapist in your area.
And chronic illness is one of those. That's how I found my therapist who actually has a chronic illness. So definitely.
Any other questions? Don't be shy. You got me here. Okay. All right, y'all. Thank you. Appreciate you. Thank you.